I thought I would start just kind of a background one as far as like 5 things that everyone should know about obesity. And so, number one, I would say, obesity is a disease, okay? This is not something that's anyone's fault. It should be given the same respect as any other disease process. It is a neurophysiologic illness, incredibly complex because it touches so many areas of our lives, not just related to physical and physiologic disease processes, but also, emotion, adaptive and maladaptive behaviors. But it is almost the disease, I would say, because it is in obesity and as we would say, adiposopathy, the negative effects of increased body fat mass and certainly visceral fat mass, more on that later, that lead to almost every other major disease that we think of in terms of hypertension, heart disease, cancer, even renal failure, metabolic associated liver disease, non-alcoholic fatty liver disease, which is what we used to call it. Obesity drives all of that. And so to really, I would argue, to treat almost all of these things and actually prevent them, we should actually be looking at treating this first. Number two, I would say, need to understand as a disease, obesity is driven by biology, not choice, not moral failing. A lot of these kind of top 5 things you're going to see as a part of, these are the kind of the core issues, kind of top principles from the International Obesity Collaborative. And that's actually kind of what I'm going through. These are the 5 things everyone should know. But yeah, it's not a choice, it's biology. We can point to even genetic markers, particular to different obesity phenotypes, that would determine actually what type of obesity treatment someone may or may not respond to. You can see these through newer forms of genetic testing, or even through history. That is a large part of how I treat in my practice, and I think that's why we have such significantly outperforming outcomes in terms of loss. But yeah, not a choice, that is biology. 3, the health effects of excess weight gain can start early. So little small bits of excess weight, excess body fat percentage, those actually, if we leave those untreated, we know that they cause negative effects, but you need to understand those negative effects start soon, okay? And so we want to be attentive to that. We should be addressing that as clinicians much earlier. As soon as we see it, we should be asking about that. Hey, at every visit, that's something we want to talk about, and actually preventing this from snowballing and causing so many other forms of illness. Number 4, obesity is absolutely treatable. There are a ton of different treatment options. And so, sometimes I mentioned obesity phenotype, which I think is one of the most important things in the treatment of obesity. Not all obesity is the same. And so some people will respond the most to just education, learning, emotional brain training, cognitive behavioral therapy. Other people may need surgery if there's a pressing issue. Other people may respond to one or another type of medication. All of these are options, and the experienced obesity medicine physician is going to be able to tell you what is best for you and proceed on that path. Absolutely treatable, okay? And number 5, obesity and weight bias is a absolutely real thing. Having been on the other side of that for most of my life, it's absolutely terrible. And one of the most sad things is the extent to which all of us who have experienced that to a greater or lesser degree internalize that. It's awful. It's damaging, and that level of discrimination, whether it's in how we are going to cover or not cover meds for this, or how we are going to, treat people in our society is just incredibly harmful. And we need to be confronting that and dealing with that these patients who suffer from this disease deserve the same amount of respect and accountability and coverage for appropriate treatments as people who suffer from any other disease. And that's my top 5.